Traditional Chinese medicine, TCM, health knowledge for women's menopause syndrome for women. Menopause is a special period during which emotional fluctuations are common, making self-care and health maintenance essential. Here are some TCM health methods for managing menopause syndrome in women. Differentiation of syndromes in TCM treatment of menopause syndrome in clinical treatment. The first step is to differentiate syndromes. Generally, the primary issue is the imbalance between yin and yang of the kidneys. Key points in differentiation include distinguishing the properties of yin and yang. Within kidney yin deficiency, one may see symptoms like internal heat due to yin deficiency, essence depletion with blood dryness, dryness due to yin deficiency, edema from yin deficiency, and disharmony between heart and kidneys. In kidney yang deficiency, symptoms may include yang deficiency, spleen and kidney yang deficiency, both yin and yang deficiency, and mixed cold and heat conditions. Medication selection in TCM treatment of menopause syndrome. Traditional Chinese medicine suggests that herbs such as safflower, notoginseng, motherwort, astragalus, and rare medicinal materials from the Yunnan Guzhou Plateau can be combined to nourish yin, tonify kidneys, invigorate blood, regulate menstruation, strengthen the spleen, and dispel dampness. These remedies are extremely beneficial for menopausal women, helping regulate endocrine functions and assisting the body in establishing a new balance to restore normal physiological conditions. For instance, nourishing yin and tonifying kidneys can improve the emotional instability experienced during menopause. Invigorating blood and nourishing qi can specifically address symptoms like excessive sweating, hot flashes, insomnia with vivid dreams, and dizziness. Commonly used medications in TCM treatment of menopause syndrome. Common TCM preparations include Luwei Diwang Wan, 6-flavor Ramani pill, Goteng Diwang Wan, Jabai Diwang Wan, Wuzizhu Wan, Jingkui Shenqi Wan, Tianwang Buxin Dan, and Gengnanan capsules. It's essential to take these under a doctor's guidance, as menopause syndrome is a chronic condition in TCM that requires consistent treatment rather than expecting quick results. Other treatments in TCM for menopause syndrome. 1. TCM techniques such as acupuncture, ear acupuncture, plum blossom needle therapy, and massage therapy have proven effective. 2. Dietary therapy, such as mulberry and glutinous rice porridge or walnut porridge, can be employed according to different syndromes to promote the yin-yang balance of the kidneys. 2. 4 major health benefits of exercise for menopausal women. Improving osteoporosis symptoms. After menopause, estrogen levels drop significantly, which greatly impacts bone health. The deficiency of estrogen leads to increased bone resorption, disrupting the balance between bone formation and resorption, resulting in decreased bone mass and osteoporosis, which can lead to fractures that are difficult to recover from. Aerobic exercise improves blood circulation in bone tissue, affecting bone metabolism. Engaging in aerobic activities not only stimulates the secretion of estrogen, testosterone, and growth hormone but also inhibits bone resorption. Outdoor aerobic exercise promotes calcium absorption and bone mineralization, helping improve bone tissue and increasing bone strength. Improving cardiovascular health. Exercise can increase estrogen secretion, which regulates cholesterol deposition and metabolism, reducing the production of vascular cell adhesion molecules, thereby decreasing the incidence of cardiovascular diseases. Reducing anxiety and depression symptoms. Research indicates that regular aerobic exercise can reduce the incidence of depression. During aerobic exercise, the body produces substances called endorphins, which have a calming effect and act as natural tranquilizers, effectively managing the abnormal emotions of menopausal women. Improving sleep quality. Many menopausal women experience sleep disturbances due to symptoms like hot flashes and night sweats. Studies show that if menopausal women engage in physical activity and exercise during the day, they tend to sleep better at night. This research primarily focuses on women aged 54 to 63 experiencing hot flashes and night sweats. Additionally, insomnia caused by these symptoms can be alleviated through a combination of exercise, dietary therapy, and TCM medications, such as drinking warm milk before bed and consuming foods and herbs that nourish kidney yin. 3. 5 dietary considerations for menopausal women's health. Supplementing foods rich in sod. Vegetables and fruits contain approximately 600 types of natural antioxidants, with sod, superoxide dismutase, being the most abundant. Foods high in sod include kiwi fruit, pomegranate, blueberries, apples, raspberries, grapes, and sea buckthorn. Sod is a unique enzyme in the human body that catalyzes the dismutation of superoxide radicals, protecting cells from damage and delaying the onset of menopause. Therefore, to slow the aging process, women should consume plenty of fresh fruits and vegetables to replenish essential nutrients. Increasing protein intake. Among the more than 20 essential amino acids, 8 cannot be synthesized by the body and must be obtained through food, particularly from dairy products, eggs, lean meats, fish, and soybeans. These foods effectively alleviate discomfort associated with menopause. Soy products, rich in phytoestrogens, are especially beneficial for delaying the onset of menopause. Thus, women should manage stress and ensure a diverse diet while incorporating more soy products to alleviate menopause symptoms. Moderate carbohydrate intake. Carbohydrates are abundant in rice, flour, legumes, fruits, vegetables, and plant roots. They serve as a source of energy. However, excess carbohydrates convert into fat for storage. Low-fat diet. Limit intake of animal fats, such as lard, butter, and ghee, as well as foods high in cholesterol, like egg yolks. Saturated fatty acids in these foods can significantly increase cholesterol levels in the blood, promoting arteriosclerosis. It's advisable to use plant oils, such as corn oil, soybean oil, and peanut oil. Maintain a light diet. Limit salt intake to under 6 grams per day. Menopausal women are more prone to hypertension and arteriosclerosis, and excess sodium from salt can increase the burden on the heart and blood viscosity, raising blood pressure. IV. 3 common psychological changes in menopausal women. Upon entering menopause, women first experience changes related to menstruation cessation, with some perceiving this as a sign of life ending, leading to changes in their mental and emotional states. Common symptoms include pessimism, anxiety, irritability, insomnia, and neurosis. Additionally, some women may experience symptoms of menopause that further impact their emotional well-being. The most common psychological changes include anxiety. This is a common emotional reaction during menopause, often triggered by minor stimuli that lead to significant emotional fluctuations, increased irritability, and difficulty concentrating. Pessimism. Symptoms arising during menopause, although not severely impactful, can lead to excessive worry and concern. Even minor discomforts may cause women to believe they are facing serious health issues, leading to emotional depression, fear of aging, concerns about memory loss, disorganized thoughts, and a tendency to dwell on unpleasant memories. Changes in personality and behavior. These changes manifest as suspicion, selfishness, nagging, irritability, and sometimes insensitivity. Women may experience unprovoked irritability, fluctuating excitement, sadness, or feelings of loneliness and despair, resulting in difficulties in interpersonal relationships at work and in social interactions. Not all menopausal women experience these changes to the same degree. They can vary in severity and occurrence. Menopausal women should recognize these psychological changes and understand their patterns to facilitate self-regulation.